The former head of Ontario's science table is calling for mask mandates to be reinstated across the province. He says the time is now as hospitals struggle with capacity issues while anticipating rising COVID-19 cases and influenza. Jason Gaidola has the details.
ER closures mixed with a rising demand for health care has one ex-science table member calling for the return of one of the first COVID-19 preventative measures.
Seen stories about children's hospitals being extremely stressed with RSV and other viruses. We're starting to see influenza cases for the first time. So think of masks as a strategy to reduce all of those viruses, not just COVID.
The former head of Ontario's science table, Dr. Fahad Razak, says mask mandates should be reinstated as COVID-19 cases increase and flu season looms. Razak says a strained hospital system normally seen through a bad flu season occurred in August and September.
Surges in influenza challenged our health system even before COVID. So, for example, some of the worst capacity issues I've seen in my career was the winter before the pandemic in the middle of a bad flu season.
Razak says coverings should be worn in busy places like transit, grocery stores, and schools. But the idea has the public feeling mixed.
You feel comfortable wearing a mask, then wear a mask. If you don't, then don't. But I don't think that putting a mandate on people will fly a second or third time around.
You know, during the pandemic, there was the cases of flu were so far down, and I think that just proves a point that masks are necessary and that we should continue to be wearing them because we're far from over.
Public Health Ontario says COVID-19 activity in the province is generally stable, but the proportion of the new Omicron subvariants, which appear to be more transmissible, is growing twice as quickly as the current dominant strain. According to the City of Hamilton, there are currently 10 people hospitalized with COVID-19. 2 of them are in the ICU unit. According to Hamilton Health Sciences head of ICU, Dr. Bram Roshworg says despite low cases, the system is dealing with higher volumes of other illnesses.
Practicing intensive care medicine for 7 years, 8 years, and I think our capacity to handle surges in patients is lower right now than it's ever been during the time that I've practiced. And so I think it does have to do with the workforce and the limitations. We're always short when it comes to nurses, respiratory therapists, allied healthcare.
Dr. Razak added that he doesn't believe the system has very many options to boost capacity and staffing throughout the winter months and says it will likely take years before it reaches a sufficient level. Adam?